Good afternoon. Thank you for joining us for the Office of Research Institutional Review Board Cayuse training. I am Tiffany Willoughby, Research Education Programs and Outreach Manager in the Office of Research. I will be your moderator today. Joining me today to deliver the period of instruction is Mary Beth Goodnight, Institutional Review Board Specialist in the Office of Research Integrity and Outreach. Welcome, Mary Beth.
Thank you, Tiffany. Hello, everyone, and thank you for joining us today. The first thing I'm going to do is share my screen so you can see, and hopefully you can all see that now. Okay. So today we're going to be talking about Cayuse. Cayuse is our new online submission portal. We were previously using mostly paper forms to submit applications and modifications and renewals. Now everything will be submitted via Cayuse. So the first thing you'll want to do when you click on the link is click Cayuse IRB. So we don't want to deal with any of the other links on here. We want to click Cayuse IRB. And it's going to take you to a page that looks like this. So I will say that I'm using our training site during this testing. So the live site does look just a little bit different when it comes to the application questions and such, but the overall format is the same. So when you log in to Cayuse, and you'll log in using your UTD net ID and password, if you do not have access, let us know. We will add you to the system. That way you'll be able to go in and access it. Once we add you, it usually takes about 12 to 24 hours for the system to update so that you'll be able to access it. So this dashboard is the first page you'll see. There are a lot of different sections that we're going to discuss. So the first one will be these boxes at the top. So in draft means this is you or somebody you're working with has started an application. So it's been drafted. It has not been submitted yet. Awaiting authorization means that it is waiting for someone to certify the application. So in Cayuse, certify means approve. We used to require that you signed a modification form or you signed an application form. Now you're going to do it all in Cayuse. When it is awaiting authorization, it will send you an email and it will say requires certification. So whether you are a PI, co-PI, or faculty sponsor, you'll have to certify the application. So if you think there might be some studies for your students that you haven't certified, you can find them either in your email, but you can also look in this awaiting authorization box. Pre-review means that it has been submitted to our office. So it has been drafted, submitted, everybody has certified it, and it is now with review with the specialists. We review it. It either goes back to you if additional information is needed. It will send you an email when that happens as well. And it will go into your in draft box. If it's ready to be submitted to the IRB, we will submit it and it will be in the under review box. This is a good way to be able to tell the status of your application. So if you think it might have been submitted to our office, but you're not sure, you can check here. It's either in pre-review or it's going to be awaiting authorization, or potentially undrafted if it has not actually been submitted yet. It also shows you all of your studies and your tasks. So if you need to view, certify, complete, if something's expiring, it will tell you the tasks in this section. It also tells you your submissions by type. So how many renewals, how many modifications, and closures. We'll talk about the legacy application in just a moment. Your approved studies are listed on the bottom left side, and your studies that are expiring. So this is really great. We won't be sending out individual emails to PIs anymore. They'll all be in the system. The system will automatically send you those emails. It will say action required. Once it gets closer to there, it's going to tell you that it is impending expiration. All of your expiring studies will show up here, and you can choose if you would like 30, 60, or 90 days so that you can figure out which studies might be expiring in the next 1, 2, or 3 months. There's also an expired studies section. You want to make sure that you don't let studies expire, and if they do, you get them submitted as quickly as possible. If the studies have been expired for about 30 days, we usually go through the administrative study closure process. Once a study is closed, it cannot be reopened. It has to be resubmitted as a new study. So you want to make sure that you don't let your studies expire and that they are submitted before the expiration date. So the legacy application is what seems to be confusing for a lot of researchers right now. all the studies that were previously approved. So before we implemented Cayuse, the legacy applications are those studies. So if you had a study approved 3 months ago or 3 years ago, those are going to be submitted into Cayuse as legacy applications. The legacy application is basically a screenshot of what your study was approved for. So it should be what is exactly approved right now for your study. The application to do the legacy is shorter than the regular application because you already have approval, everything has already been approved. But we do have to have that information put into Cayuse because when you submit modifications or renewals, you're going to be doing it based on that legacy application. So if I currently have a study approved, I have to put it in the system and fill out the legacy application. Once I do that, I can submit modifications or renewals. I can close the study. When I submit a modification, which I will show you in just a little bit, you'll be making changes to the actual application. So in this case, it would be the legacy application. So if I have 100 participants approved right now, and I want to modify it to be 200 participants, I will actually go into that application and change the 100 to 200. So that's why it's important that the legacy application has been processed and that it includes everything that has been approved. If you have a study that was approved 5 years ago and there have been 40 mods, it should include what is approved right now. So if the first 10 mods changed the number of participants, you want to do the most recently approved modification for those participants. So in Cayuse, we don't really need to know what has been approved throughout the entire study, but what's approved right now, what you're approved to be doing at this moment. When you need to submit the legacy application, you will be able to find it in Cayuse. And you will select, let me see if I can find a legacy application right now. I'm not sure we have one here, however, it's going to be very similar to everything else you do in Cayuse. So there will be an option that will tell you to submit the legacy study. Here we go. So there will be a new submission button like this. When you on the study details page for your study, you'll click New Submission and you'll select the legacy application. It's going to then ask you to input the currently approved study into Cayuse. You'll need to attach all of your approved consent forms and surveys, interview questions, anything that's approved will need to be attached in that application. Once you do that, it will then be processed and it will show up in this Submissions tab. It will show up just like this and it will say Review Complete. Once you do that, you'll be able to submit other requests. So if the study needs to be renewed or if you have modification, nothing can happen in the system until you complete that legacy application. So you really need to make sure that that is completed before you need to submit a modification or a renewal. So now we will start with a new study submission. So you will click the New Study button. It's going to ask you to put your title in. So you put the title and you click this little blue check mark. Then you'll see that it says unsubmitted. So this means that it's in draft. You're starting to draft the application, but it has not actually been submitted yet. There's not a lot of information on this page because nothing has been done to the application yet. You then click New Submission again, and you click Initial. So since the study has not actually been approved yet, no other options show up here. Once the study has been approved, you'll see all the other options that you might need, such as modification, incident, study closure. You'll click Initial when you're ready to submit to begin the submission process. And you have to click Edit so that you can actually go into the application. This first page tells you about Cayuse IRB as well as what is required from the PI and faculty sponsor if applicable. So you'll want to read this information, and once you have read it, you will click this Yes button indicating that you are ready to begin. When you do that, this Submission Information tab opens up. You'll select that tab and this begins the actual application. Now you'll need to decide, is your research collection of new research data? So are you collecting data via surveys, interviews, some type of interaction with participants? Does it involve only secondary data? So are you only analyzing existing data? If so, you'll select that option. For this fall semester, class projects are not actually being submitted via Cayuse for right now. They will be starting spring. And UT Design project, if you're in a UT Design course, you'll select this option. I'm going to select collection of new research data for this example. I also want to note the save button up here. You want to make sure that you're clicking that so that it is saving the information, so that if you get logged out or if you forget about it and move on, when you come back, everything has been saved and you don't have to re-enter the information. You can add the principal investigator, the PI. So you'll click Find People. You will then type in the first or last name and click the little search button. My name is in here. You click this plus button over here. It shows that it's selected me, and then I click Save. It includes all the information that the system needs for me. If you select the wrong name, you can click this little X button and start over. This application says to contact our office. If you can't find somebody, you can definitely do that. The live site actually has a link where you can enter the person's name and net ID, and that way we can add them quickly. The system will automatically select the PI as the primary contact. You can easily change that by clicking the little X, clicking the Find People button, and then choosing who you would like to be the primary contact. I'm going to make Yesenia the contact. It's important to note that the PI, the co-PI, faculty sponsor, and primary contact are the only individuals who can access and edit the application in Cayuse. So you want to make sure that if you have a couple RAs that are they're just research assistants on the study, but they actually need to come in here and submit modifications or submit requests, they should be listed as primary contacts as well, because that way they're able to actually see Cayuse on their dashboard, see the study in Cayuse on their dashboard, so that they can access the study and submit these requests. The application is going to ask you a lot of questions about your study. So is it a multi-institutional study? If you say yes, it's going to ask you additional questions about who is the IRB of record, or is each institution conducting its own review? As you're selecting answer choices in Cayuse, it's going to kind of guide you to the next appropriate section. So if I select no, that information disappears because it's not applicable if it's not a multi-institutional study. The study information section. This question is not on our live site, so I'm going to skip past that. Study personnel. So it asks you the status at UTD. So am I a staff, student, or faculty member? For this example, I'm going to say I'm a faculty member. If I'm a student or a staff member, it's going to ask me for my faculty sponsor. You would just add your faculty sponsor in there. Co-PIs, and then other personnel. So when I talked about the example with RAs, they would be listed as other personnel if they're not a co-PI. These other personnel cannot actually access this study in Cayuse, so they should be listed in both places if they need to access the study. Are there individuals not associated with UTD that are engaged in the research? So are you working with collaborators from another institution? Do you have some UT Southwest faculty members involved? If you select yes, it's going to ask you to provide a document with their names, their role in the study, and their affiliation. So UT Southwest or UT Austin. It's also going to ask you to provide the HSP, Human Subjects Protection Training certificates for all study personnel. So you want to make sure that this includes everybody. So the PI, the co-PI, everybody involved in the study. You'll attach it here. You click the attach button. You click this little plus button, and then you click add file. Then you'll select whichever documents are appropriate. So I'm going to select the training certificate. You can select as many documents as you want. They can be Excel, Word, PDF, and you'll click apply. It will then add my certificate here. If I selected the wrong document, I would click this X, and then it will let me attach more documents. If the study is a clinical trial, it will ask you specific questions related to clinical trials. I'm going to say no for this example. Study site. So where is the research being conducted? I'm going to say UTD, and you can select recruitments, procedures, data analysis for all of these options. If you select the UTD Brain Health Imaging Center, the MRI imaging portion of the application opens on the left side. So if you're doing MRI at the UTD Brain Health Imaging Center, you'll want to select that, and then you'll have to answer the questions related to MR imaging. For this example, I'm not going to use that. And are the performance sites that are non-UTD affiliated? So are you doing research at a church, your place of work, another institution? You'll list the performance site, and then you'll describe what research activities are taking place. So are you hanging flyers at coffee shops and community centers, libraries? Or are you actually doing research somewhere? Are you conducting procedures at UT Southwest? Are you doing data analysis at your house? Where's the research taking place? You can add additional non-UTD affiliated study sites. And then you'll also need to attach an IRB approval letter or letter of support confirming that you have permission to conduct this research if it's applicable. So the system requires this. If you're doing research at your house, you don't need a letter of support. So you can just attach a document saying, I'm doing research at my house. No letter of support is needed. If you're going to place flyers in coffee shops and such, we don't require an actual letter of support, but it's important that you go ahead and ask the manager or somebody there if it's okay to hang the flyers, unless it is just a publicly available space where that is allowed. If we're doing research with UT Southwestern, a lot of times their IRB office needs to know about it. So they're either going to give you IRB approval or they're going to send some type of email confirmation saying that they don't believe their personnel or the research needs to be approved there. And that's something that you could also attach. So it doesn't have to be anything formal. It can be just an email correspondence. Study dates. So the approximate start date. So I'm going to say December 1st and the approximate end date, December 31st. You can do whatever dates. Just make sure the start date is actually in the future and it's not the beginning of last month, because I'm going to ask you to change that. But this is just an estimate. So if you say it's going to December and you decide later you want to change it, there's no problem with that. If the study is funded, you will indicate the type of funding. So federal, industry, status, is it awarded or pending? And then you're going to find the funding sponsor in this Find Sponsor button. It's very similar to the People Finder. You type in the information and then add the sponsor. You'll also add the grant title. If you know the PeopleSoft project ID that is used by Office of Sponsored Projects, OSP, it's great if you can include that in there. If not, this is an optional field, so you don't actually have to do that. As I'm going through, you'll notice that there are these check marks on each section. In order to submit the application, you have to have a check mark on each one. You can do part of it, the section, and then do the rest later. Just make sure you're saving. But in order to actually submit the application, they all have to be check marks. This section is going to ask you to describe study design. So the purpose, the hypothesis, why are you doing this? The background. So what is the background? What is the significance of this research based on the existing literature? Just briefly describe those studies. If there are no studies that form the basis for this research, then just let us know that. Design a methodology. So explain how the data you plan to collect ties in with your research questions. So we know what you're trying to do. Now explain to us how the data you're getting is going to help you do that. Study population. Now it's going to talk about enrollment. So how many participants are you enrolling at UTD or non-UTD affiliated sites? And then include the total enrollment. Unfortunately, the system does not automatically add that, so you will have to add that. Does your study involve vulnerable populations? This section has been updated on the actual Cayuse site, so it will also include non-English speaking individuals and other potentially vulnerable populations. Once you select these options, it's going to ask you additional questions. So if you're including minors, what is the age range? Why is it necessary to include them? What kind of special arrangements are being made? How are you going to ensure that they know it's voluntary, they're protected, they can stop at any time? The same thing with UTD students. It's going to ask you why you need to include them and what special arrangements are being made to prevent undue influence. So we don't want UTD students to be just a sample of convenience. So we want to know why they're a good fit for your study and why they should be recruited. And as far as special arrangements, you want to make sure that they know that it's voluntary, they can stop at any time, and it doesn't affect anything related to UTD. So their grades, their education, their employment status here. If it's a professor asking students to participate in the study, they need to know that those grades in that class or their relationship with that professor is not affected at all by participating or not participating in the study. If your research does not involve any vulnerable populations, then you can select none of the above. Inclusion and exclusion. So we need to know who's included and who's excluded and why. So if you're only including individuals who are right-handed, what's the justification for that? If you're only including women, why are men excluded? If you're only including 18 to 35, what is it about that group that makes it a good fit for your study? So you'll notice that I did not put information in these sections, so there is no check mark. It means that it's not completed, and I would have to go back and fill that out. Recruitment method. So how are you going to tell people about your study? Is it verbally, face-to-face? Is it social media? Is it using a SONA system, email, advertisements? If you're placing advertisements, where are you going to hang them? Is it on campus? Is it coffee shops? And the recruitment procedures. So if you're emailing individuals, how do you have their email addresses? Are you doing it through your course and e-learning? Are they your friends and family? How do you have those email addresses or the phone numbers? If you're recruiting verbally via face-to-face, how are you doing that? Are these individuals you know? And if not, where are you recruiting them from? And making sure that that is not seen as anything coercive. If you're standing outside of a doctor's office and you're asking them to participate in your study, is that an invasion of privacy? We want to know how you're actually going to find these individuals who might be eligible for your study. Screening procedures. So are there any screening procedures? And maybe it is as simple as anybody can participate, so there are no screening procedures. If you want individuals who are only right-handed, how are you going to ensure that they are right-handed? Are you going to ask these questions via telephone? Is it in part of the online questionnaire? If you're looking for a specific age group, are you going to ask them for their age? We want to know about the screening procedures. And then what happens to the data if you find out participants are not eligible or they decide not to participate? So if I do half of the study and decide to withdraw, are you going to use my data? Or are you going to destroy it? If you get some data from me and then you figure out I'm actually left-handed, are you going to stop participation and delete that data, or are you going to continue using that? That's the information the IRB wants to see here. And then participant payment. So will participants be paid an incentive? So an incentive could be money, it could be gift cards. Previously, we were using ClinCards. Now it's moving to Galaxy Pay, which is very similar to ClinCards, basically a prepaid MasterCard. Are you giving, is it a raffle? Is it a raffle to win an iPad? Or if there's children involved, are you giving them a stuffed animal? Anything that they're getting for their participation, we want to know about that. That would be considered an incentive. So you would select yes, and then you would complete this section to provide information about what they're getting, how much, how often, when they're going to be paid, and then is it prorated? So if I complete half of the study, if you're doing a study and you're going to give $20 and I complete half of it, do I get $10? Do I get $5? Do I get nothing? All of it? That's what prorated means. And then are participants reimbursed for parking, travel, or other expenses? If you are just bringing participants in and you're not making them pay for parking, That's different. If you're going to have them go somewhere where they're charged for parking, then are you going to reimburse them for that? I'll go ahead and take a break and see if there are any questions at this time.
Thank you, Mary Beth. There are questions in the queue. The first one is, I get secondary data from sources outside the university. How can I tell whether these data providers are collaborators?
That's a great question. So if it is human subjects data, so if it's data from human subjects, we would want you to submit a study and you would get some type of approval from whoever you're getting that data from, that you have access, that you have permission to access the data. As far as whether they are collaborators or not, kind of depends on if they're part of the study. So did they just collect this data and they're giving it to you and you're analyzing it by yourself or with UTD people and they're not really involved with it? That would not necessarily be a collaborator. If you're both going to analyze the data together and discuss it and try to figure out whatever results there are, then I would consider that as part of a collaboration because they're actually involved with like the data analysis part. So if they're just providing the data, I wouldn't really consider that a collaborator. But if they're involved with the study, then I would say yes, they are a collaborator.
Thank you, Mary Beth. Next question. What is the research site for online surveys?
So I think this question is asking for a website to complete online surveys, to have participants complete the surveys. If that's not correct, feel free to type that in there and Tiffany will let me know. You can use Qualtrics if it's less than minimal risk, depending on what information you're collecting and how the consent process needs to be done. You can also use REDCap if the study involves risk or if you want to collect consent using the same platform. REDCap is great. Those are the two main ones that UTD uses right now. But if there's another one that you're looking into, you can definitely let us know and we can see if it's approved for research purposes at UTD.
Fantastic. We do have two more questions in the queue at this time. Is early access to the results considered an incentive?
That's a great question as well. I think it would depend on the specific study, but I think I would say it is something they're going to be getting. So it does depend on the specific study, I would say, of how that might be an incentive. So is getting those results going to help them in some way, or is it just kind of here's what we found? I would say you could always err on the side of caution and indicate that it is an incentive. And if the IRB disagrees, you could just remove it. It's not challenging. But I would say it depends on the specific study.
Thank you, Mary Beth. I'm going to bump back to the previous question, and that was, what is the research site for online surveys? The attendee responds with, this was about the spot on the form where we're asked to specify a site like UTD. There really isn't a location for something online.
Oh, gotcha. Okay. Yes, so let me go back to that section. So if it is a non-UTD affiliated site, if it's like a specific website, you can put that information here, but it will also be really important to include it in the procedures section as well. So if you're using like a website like Qualtrics or something, that information should be in the procedures section. You don't necessarily have to put it here, although we do typically like that. But if you're going to be doing research at like a church or library or place of work, that's where this section would capture that information. You would put the performance site and the activities that will take place there.
Thank you, Mary Beth. And I believe there's one more question in the queue, and it is, what is the due date to apply for legacy applications for existing studies?
So there is actually not a specific due date for that. So we are not going through and going to require you at this time to do that. However, it does have to be done before anything needs to be submitted. So if you need to submit a mod, the legacy has to be done before that. Same thing with the renewal. So before you can actually do anything, change any part of the study or submit anything, the legacy has to be done. But as far as whether you want to do that now or in a month, it's really up to the researchers. You just want to make sure that you do it before anything else needs to be submitted, because if you try to submit the renewal needs to be done quickly, you still have to do the legacy first, and it can be a little bit time consuming. So you want to make sure there's enough time to get everything in before the study expires or before you need to submit any type of modifications.
Thank you for your answers, Mary Beth. There are no additional questions in the queue at this time.
Thank you, Tiffany. And please feel free to keep the questions coming. So we'll move on to the consent process. This section is going to ask you about how you're going to obtain consent. So are you using an online consent procedure? For less than minimal risk studies, that would be processed as minimal review. That could be done via Qualtrics, clicking an I agree button. For expedited or full board studies, online consent procedure still needs to obtain their signature, their name and their signature. You need documentation of consent unless you're requesting a waiver of written consent. So the application can get a little tricky with this part because we don't really ask you to determine whether it's minimal or expedited or full board. That's something that we have tried to eliminate so that when it comes to our office, we can make that determination so that you're not having to submit a minimal review application and then we say this is the wrong level of review and you have to then submit expedited. It's all in one application. But in doing so, you do need to determine, based on the level of review, what type of consent process you're looking at. We've had some studies recently that submitted, I think, believing that it would be minimal review, and unfortunately it was bumped up to expedited. So they did have to update this part of the application. They either had to request a waiver or they had to indicate that they would obtain signatures via a website such as REDCap. There's a couple different ways to do it. However, we do recommend using REDCap if you're going to obtain signatures. Qualtrics is not approved to obtain names and signatures for documenting consent at this time. So if you're using just an I agree button, that's fine. But if you're going to obtain signatures using like a survey website, you would want to use REDCap. We have resources for REDCap on our website. If you're requesting a waiver, then you would select this checkbox, which does not apply for like minimal review studies because you don't need signatures anyways. It will then ask you questions about the waiver. So you have to be able to justify that it doesn't present more than minimal risk to participants and how it's not harming them, how their rights are not being affected by that. If multiple forms of consent are being obtained, you'll want to include that information here. So maybe it's a two-part study. In the first part, they're providing consent online. And the second part, maybe they're going to do it in person, depending on the status of COVID research, whether you have approval to do in person or whether this might be done in a year or two. This is the information that we need to know here. And then it will ask you to attach a copy of the consent forms. So if you've got parental consent, children's assent, anything like that needs to be attached here. Then you'll be asked to describe the consent procedure. So what is going to happen? If I'm doing research in person, which I know is very unlikely at this moment right now, but before or after the pandemic, are you having the participant come in and you're going over the consent form together and you're both going to sign it? Is it in a private location? It's not in the middle of a busy waiting room where everybody is around and the participant might be worried about asking questions or maybe not understanding what information is being provided to them. If you are collecting it online, are you going to be talking on the phone or like a video conference with the participant, or are they going to do it all on themselves? You just sending them a link and they're going to provide consent? If you are doing consent online, what platform will be used? So include as much information as possible in here, remembering that the consent form should be a process. So they should be required to confirm their understanding. And if you're talking with them, it should be more of a discussion rather than just here's a form, sign it, and we'll move on. You'll need to indicate how it will be determined whether the participants understand the information. So are you going to ask them questions such as, what is the purpose of this study? What should you do if you decide to stop participating? Those types of questions are really great to determine their comprehension of the information. If you're in person, it can just be done verbally. If it's online, REDCap actually has templates that are set up so that you can include those types of questions, and they can be multiple choice. If they get it wrong, it should guide them to review the consent form again and find the correct answer. Since you're not there in person to kind of walk them through and point out where it is in the consent, then you would want them to be guided to re-review the consent form, and so that they can provide the correct answer. And they should not be able to proceed until they provide that correct answer. That's kind of the way of documenting consent, that they understood it. We also have consent form templates on our website, and then there's a couple in REDCap as well if you select the template option. Research methods. How are you doing the research? Is it one-on-one interviews, focus groups, questionnaires? Does it involve secondary data analysis? So even though the beginning part of the application asked if you were only doing data analysis, that would be if there was no data collection involved. This might be where you're collecting data and analyzing existing data. That's where you would select this secondary data analysis, and it will bring up questions related to that part of the study. If you're audio or video recording, if you're using like MRI, EEG, you can select all these checkboxes if they're applicable for your study. This question is really important given the current situation. So are procedures in person, online, or in person and online? Whichever option you select will bring up specific questions. So I will go ahead and select both just so we can kind of see the questions that are being asked. So even if the research is online, will you be delivering items to participants? So is it an iPad that they need to complete the study? Anything that might need to go to them, if you select yes, it's going to ask you how you're doing that. Are you disinfecting it before and after you get it? Are you dropping it off? Social distancing? Are you mailing it to them? This is the type of information that the IRB needs to see. Describe each activity in which participants will be involved. If it's an online survey, how long does it take? What types of questions are involved? Is it about their behaviors and their food preferences and whether they like dogs more than cats? That type of information should be included in there. If there are follow-ups, if it's a longitudinal study, if you're doing MRI, EEG, any of the procedures, it should be really outlined clear in this section so that we have an idea, the specialists and the reviewers have an idea of what that participant is going to be asked to do. So make sure that's just as detailed as possible, helps us review the study. If you're doing in-person procedures, this section will pop up. The first thing you'll have to do is describe the justification for why you can't accomplish these online. So if you're doing MRI, you can't do the MRI online. But if you're doing like interviews, why can't the interviews be virtual? If you're doing questionnaires, why can't they be done online or virtually using Teams or WebEx or a video conferencing platform? It's also going to ask you about social distancing, devices used, how you're going to ensure that there aren't 10 participants waiting in the waiting room. There's only one at a time. Do they wait in their car before you have to do all of the special checks for in-person research? Size of the space, how you're going to disinfect it, all of those questions. This is a section for study instruments. So if there's anything that hasn't been attached, maybe you didn't find a specific spot for it, you can attach it in this spot. It is optional, so you don't have to put anything in here, but it might be a great place to add things that you didn't find a good spot for before. Does this research involve collection or use of data recorded in a manner that could potentially identify individuals, either directly, so it has their name attached to it, or through a code or through some other type of identifying information? You select yes, it will ask you what type of identifiers are being collected. We'll need to know why this is important as well. Devices or substances, so if you're using a device, you'll select the device option, and then you'll provide the names, manufacturer, that type of information. If you're using substances, you will include the type of substance you're using. If you're using none of the above, you'll select that. Risk benefit. So this section depends on whether you believe the research is less than minimal risk, or very rarely greater than minimal risk. When you select these options, it will bring up different questions. You'll select what you think is appropriate for your research. The IRB may come back and say, we disagree with this, and then we'll have to have discussion regarding the risks of the study. You want to indicate the potential risks. So what are the risks associated with MRI, EEG? If you're walking on a treadmill, can you fall? If the questions ask about suicide, how does that affect their mental, emotional state? These are the types of risks we're looking for. If they're completing 2 hours of surveys, could they become bored or tired? Is there a chance of loss of confidentiality? So if their data is released somehow, how could that potentially harm the participant? You also describe like the probability, the magnitude, and duration of the risk. So what is the likelihood that this will happen, and what are the potential risks associated if it does happen? You'll describe the expected benefits for participants and for society. There should be a potential benefit for society if you're conducting research, but there may not be direct benefits for the participants. So you can indicate that if there are not. It's important to note that incentives, whether that is money or results, are not considered benefits of the study. Deception or incomplete disclosure. So are you withholding some information? Are you not telling the participants something so that they don't react a certain way? If you're looking at the effects of age and gender, maybe you don't want to tell participants that because you don't want them to react in a certain way. If so, you'll select yes, and you'll describe the incomplete disclosure, why you need to do that, and then how the participant will be debriefed, and a copy of the debriefing form, which should provide information about the true purpose, why the deception was needed, and the option for their data to be removed if they want it to be removed. So if I've participated in a study and I consented, but what I consented to was not the true purpose because deception was involved, at the end of that study, I have the right to say, I want my data removed from the study, and you would need to destroy that data. Minimizing risks. Are participants able to skip questions? Is the data coded or anonymous? Do they have opportunities to stop or take a break? Whatever boxes are most appropriate, select those. Describe any other precautions that might be taken. So if the questions ask about suicide, are they provided with resources for the counseling center or national hotlines, those types of things. It'll also ask if your study involves suicidal ideation questions. And if so, you'll select yes. You'll answer the question indicating that all study personnel involved with the study who will be interacting with these participants will complete the question, persuade, refer QPR training. And then you'll provide a copy of the suicide ideation response plan. So if I'm a researcher and I'm asking these questions and somebody says, yes, I'm suicidal, you can't just say, okay, see you next time. You need to make sure that you have a plan in place for what you're going to do, how you're going to respond to that, the resources that you might provide. And then conflict of interest. This is a really simple section. Does any study personnel have a financial interest? If you say yes, you select yes. We ask you to provide the names. The COI office will move forward with this. We don't need to know what that interest is. We just need to know if there are any potential interests, financial interests related to the project. This section is data security. So this is how are you going to protect the data? So you'll select the boxes that are appropriate for your study. You know, it's a collection of data limited to the amount necessary. Is it going to be captured and reviewed in a private setting, not just in the middle of a mall? Once you select an option there, other questions will appear. So is the data identifiable, coded, or anonymous? Will the data be de-identified? If so, how? How will the data be stored? Is it electronic or paper? You can select both options. It will ask you questions. If the data is being accessed on UTD or non-UTD owned computers. And then how are you going to protect the data? So are you using things like Box and RedCap? Is it encrypted? Or are you restricting access to study personnel? So you're not just letting anybody see the data. Is it all password protection? You can always select other and put in other information if you think that's applicable as well. Will coded or identifiable data or specimens be released to a third party? Are you going to share coded or identifiable data? If so, you'll select yes, and you'll indicate with who and how you're going to share that data. We recommend Box as it is a secure platform. And then when you're done with the data, what are you going to do with it? So are you keeping it for record-keeping purposes? So 3 years after the study, will you destroy that data? Are you planning to keep it to use it for future research use? If you're collecting direct identifiers or a study key, we recommend that you delete that as soon as it is no longer needed. It eliminates that potential risk. And this attachment section includes all the attachments. You don't have to separately attach them here. It pulls. So when I uploaded my recruitment flyers or any of the other consents, procedures, documents, they'll all show up here. I think I only attached one, so you'll see the human subjects protection right here, and it pulls it here. So you don't have to separately attach them. It's just a place that you can see every attachment that you have added to the study. If I had completed all the sections, it would say complete submission, and it would allow me to complete it. I did not do that. This section, so the study details section of Cayuse will tell you what's going on with the study. So once it's approved, when it's expiring, if you have requests that are either submitted or pending, you can click on them here. Once you click on those, it brings you to that specific item. So you could have a modification and a renewal open at the same time. You can also click complete submission here. This will take you to the application, or you can do edit. And I do want to quickly show a modification process. So this is a study that has already been approved. So you'll see right here that the review is complete. This submission section shows you everything. So when you've had 10 mods, you'll have 10 mods in here, and it will show you the review type, the status, and the decision. This study is exempt, also known as minimal review. When you're ready to submit that, anything, a modification or renewal, you'll click here. This gives you renewal, incident, or closure. It doesn't give me modification because I already have one open. You can only do one, you can only have one drafted at a time, but this is where you would click modification. I've already done that, so I'm going to click that. And then this will usually be an edit button. You will select edit, and you will come into this modification. So this first page is going to ask you what changes are you making, and then you're going to describe the changes and a justification. So if you're increasing the study personnel, if you're increasing the number of participants, why is that needed? If you're adding a measure, what is the importance of that? Then what you're going to do is go over to this section and update whatever is applicable. So this one is a secondary data analysis example. So describe the records. Maybe the first records was already described, and the second one, now I need to add that information here. So whatever changes you are making need to be made to the actual application. So if this was the example we just used, there would be recruitment and there would be consent. And any changes I'm making, the application needs to be updated, and then the attachments, if those are changing, need to be updated as well. We have a compare feature that is really cool, and that will show us the changes you have made from the originally approved one to the modification. So it's a faster process for us rather than having to go through and try to figure out exactly what is changing. So all the changes need to be made in the application, and this modification form is just kind of like a brief summary. So I'm adding personnel, I'm updating number of participants, and this is why I'm doing that. And then you'll make the changes in the actual application. So when you go back to your study details, you'll be able to see exactly what is approved for the study. You'll go to the submission. This one has not been approved, so this is what is approved. So whatever is in this application is what has been approved for your study. So now I'm going to see, are there any questions, Tiffany?
Yes, ma'am. There is one question in the queue, Mary Beth, and the question is SONA credit an incentive?
Yes, SONA credit is an incentive. There is an option for SONA in there, and you'll indicate how many credits they should be getting. As far as I know, it was about an hour of research for 1 credit, unless they've changed it. So 30 minutes would be half a credit. And that information needs to be included in the recruitment materials and the consent form, and also in the application as an incentive.
Thank you, Mary Beth. There are no additional questions in the queue.
Thank you, Tiffany. So if you have any last minute questions, please feel free to post those and we will get to those soon. I also want to talk about the comments on the application. So when you submit your study and the specialists review it, we might ask you to make some changes. Previously, that was done via email. This one is really great because it's in the application. So I will go in here and show you an example. Under each section of the application, which is not showing up right now, I don't believe, because I have not actually submitted this. But when you submit this, under each section, there will be a spot that says add a comment. So that's where we will comment for you. So for example, on this one, if you don't attach all the training certificates, we're going to comment and say, please attach training certificates for all study personnel. When we do that, and we're done making comments throughout all the application, we'll return it to you and you'll get an email saying, please review and update the application. On this left side, you'll be able to tell which sections have comments because there will not be a check mark. There will be a little thought bubble and it will have a number in there, and that will tell you how many comments there were in this section. You need to update the actual application and then also click the addressed button on the comment. So you won't be able to submit it until you've made the changes and then you've clicked that you've addressed the comment. You can respond back to the comment if you want to. You also need to make sure, though, that the application is updated. So if I ask you to provide more information on the recruitment procedures, you can put that information in the comment, but it also has to be in the actual application as well. So some researchers respond to the comment and say, I've done this, I've updated it, I've included this information, and some of them just click addressed, so they don't actually respond in the comments. Either way is fine as long as the application is being updated. It's a great way to communicate as well if maybe we're just confused on something. So maybe the application doesn't need to be updated because we've missed something or you're just clarifying something. But all the comments have to be addressed. Once they are, you'll have the resubmit option and then you'll be able to resubmit it to our office. If the comments aren't addressed, it will not give you that resubmit option. And then the application, which let me add a copy so we can see this training here. So there is an option for trainings here. So this is connected to the city website, the CITI website. If you've completed city training and your email address in Cayuse matches your email address in city, it will have that information here, so you'll easily be able to see which trainings might need to be updated. If I entered my name as my email address in city, like marybeth.goodnight, then I will need to go into city and change that because Cayuse uses your net ID. So that's the way it uses it. So it would use my net ID. So I would need to make my city match my net ID, which can be done. You just have to go into city and edit that. You're not required to do that. You're not even required to do the city training. You can still do the e-learning training. This is just a feature that might be helpful for you to be able to tell which trainings might need to be updated. And I think that's it for now. Were there any other questions, Tiffany?
Yes, ma'am. Are birth dates numeric addresses without names considered identifiable?
It does depend on the study, but we do typically consider birth dates to be identifiable. If you can collect age instead, or even month and year instead, we definitely recommend that. If you need the birth dates, then you just need to be able to provide a justification for why that is exactly needed for your study. And if you're collecting other identifying information, what will be stored together, or if that's the only thing you're collecting, it's usually fine. It just depends on the specific study and the level of review. But it should be fine to collect it. We do consider it identifiable, depending on if you're collecting other information along with it.
Thank you, Mary Beth, for offering this training session to our university community. Interested in attending additional Office of Research events? Visit research.utdallas.edu. Thank you.